Thanks. Good morning. Can we get real for a sec? Do you mind if I get real with you guys? We're good with some real talk? We've known each other for a few days now, right? Like, we've hung out a bit. We meditated together on day one. We all got pissed and sloppy at the Guinness Brewery last night. We can talk like people, right? I'm picturing you all naked right now anyway, so. Jesse, buddy. Nice. Well done. So some real talk. I find the process of putting presentations like this together really frustrating. It actually drives me nuts. The reason is, and you tell me if you had the same experience, I sit around for a couple of weeks and I try and come up with an idea or a theme or a thought based around a topic I've been given, and I can't do it. I kind of stumble through it. It feels forced. And then somewhere around 48 to 36 hours before the talk, so this was yesterday or the day before, suddenly it kind of comes to you. And the ideas start flowing. They're coming out of you. It's not even appreciable where the ideas are coming from, but it's effortless. It's easy. And for this talk, the narrative just kind of wrote itself yesterday. I don't know where that came from, but it drives me nuts because I wish I could harness that feeling and put it to use a bit sooner than the day before a presentation. You ever had that experience? You can't perform until your back is against the wall, and when it is, suddenly things just start coming out of you. Has it ever happened at work with a team? I can think of the first trauma thoracotomy that I did as being an example of this, where the patient was just dropped off with very little notice or preparation. It was 3 doctors, 2 nurses, a respiratory therapist. That was it. And man, we were just humming. We were working. We were efficient. The room was quiet. And everyone worked with a sense of urgency, but not panic, or purpose, a quiet calm. And I can remember leaving that room and going back to the regular emergency department and recognizing that during that time, we were all on a very different level of awareness, a different plane of awareness. It certainly didn't apply to the routine operation that I was just about to step back into. I kind of wonder, has that ever happened to you? I wonder what that feeling is all about. It's weird. Time dilates or compresses, I'm not really sure which. Your memory is messed with, your sense of perception is odd, your recall is inhibited. It's just not really normal. And I agree completely with the point that was made in the previous talk. We spend a lot of time looking at how teams fall apart and how they underperform during crisis events, and I think that's important. But I wonder a little bit about what we could learn from teams that overperform, that are hyper-performing, from excellence in teams. There are a lot of words for this kind of mindset, the groove, the pocket, being locked in, being focused in the zone. And as it turns out, this state of mind, this combining of action and thought and awareness into one thing, is based on very valid psychological principles. That your mind, under the right set of circumstances, can drastically and radically alter your consciousness and perception towards extreme and accelerated performance. You can do this. And perhaps where this is recognized the most is in extreme sports and adventure sports like surfing and snowboarding and cycling and so on, where these athletes have seen advances in their field. They've pushed the frontiers of what they're capable of delivering in terms of performance, well beyond what we even thought was humanly possible 30, 40 years ago, by virtue of how they actively engage in the process of learning and training and skill application. Now, you would think that this state of mind has something to do with your brain lighting up with activity and you're using all parts of your brain. You know, we only use 10% of our brain normally, and maybe this is just our brain on steroids, being hyperactive. But as it turns out, that doesn't seem to be true, and there's some neuroelectrophysiology and neurochemistry data to support this, that when you're in this zone, areas of your brain are actually going quiet, not loud. It's referred to as a state of transient hypofrontality. That is, your frontal lobe, which is kind of your awareness, your self, your superego, your inner critic, goes quiet. And other areas of your brain light up and start becoming more active. And these are the areas sort of deeper in your brain that are related to information processing, to making linkages between ideas, to drawing from prior experience. Those light up more, and they're somewhat more unconscious processes of thought. As part of the reason this is important is conscious thought is pretty expensive, and it's time-consuming. And when you're in a crisis, when you have to sort of merge thought and action together, that investment in conscious thought is really problematic because you don't have the time and you don't have the resources. And we're all aware of this. So your brain can, under the right set of circumstances, shift to a more intuitive form of decision making. Scott Weingart talked about this when he talked about OODA loops last year, the ability to observe and make predictions and then go into an action loop very, very quickly based on limited information. Well, it turns out this idea has a name. And it's a technical term. It's not the name of a spin class. It's called flow. And this concept was originally thought of by a psychologist named Mihaly Csikszentmihalyi. You say that fast 10 times. And then popularized by Steve Kotler and Jamie Wheel, who've written a fair bit as part of what they call the Flow Genome Project. And these thinkers believe that understanding how to get to this state of mind, which they call flow, is kind of the key to unlocking extreme performance in a variety of domains. And they argue that you can hack this, that's their word for it, that you can start to train to produce these mindset states so that we can perform and train at a level we really never thought possible before. And flow, as it turns out, isn't just a thing, it's kind of a process. And they identify at least 4 stages to sort of unlocking these flow states. The first is a struggle. You have to be struggling with something. Something has to be difficult or scary or nerve-wracking or anxiety-producing. The idea of trying to put together a talk or going out and playing in a big baseball game. And that's kind of that fight or flight response that most of us are familiar with. The key is recognizing that it's there and then understanding techniques to push through it. And some of us do push through it by accident, and that's the release phase, where we kind of get through struggle and we get into this sort of higher plane of performance. But most of us probably just do it by accident. Most of us don't really have good strategies for doing that on a consistent basis and getting better at it. And when you get into flow, this has been described as your information processing is going from dial-up to broadband. That you can take in more bits of information, you can be receptive to more bits of data. This is the opposite of tunnel vision or premature closure in a diagnostic situation. Your mind is actually open to far more sources of input than you would have imagined possible with simply a conscious process of thought. And that's flow. And then there's a recovery stage, which is where you go into this process of learning and deep processing and deep encoding so that this goes back and it sits in your long-term memory in ways that you're able to access in the future in order to bring it to bear when the time presents itself again. And it requires a few prompts. There's a bunch of things that can prompt a flow state. Csikszentmihalyi talks about how these things need to involve things that involve deep embodiment in a very rich environment under circumstances of very high stakes. That sound like where anyone works? Because it sounds a lot like our workplace. Okay, so interesting thought stuff, but if you guys are careful and attentive listeners and critical, which I know you are, then you're going to recognize that at least some of that sounds like total bullshit, which it probably is. But for me, why this is interesting is because I've been spending a lot of time trying to figure out how to make teams work better. And I've been arguing for a while that team skills are not innate, that you have to give them a name and an identity, and then you have to practice them deliberately. And although I could point at this sort of level of high performance, I didn't really have a vocabulary to really understand it and describe it and talk about training in order to do it better. And I think that's what flow helps with. But what I want to try and do now is map out the notion of flow science onto a bunch of concepts that many of you might already be familiar with. In fact, many people have already spoken about throughout the course of this week, to make the ideas of flow seem a little bit less airy and a little bit more concrete in terms of their application to healthcare workers. And for me, the first and biggest and most intuitive area is this notion of stress preparation, particularly for multi-member teams. So any individual, when they walk into a team environment, starts to try and create this psychological map that depicts their abilities, their counterparts' abilities, everyone's needs, the task demands at hand. They all do this together, and everyone tries to put this together very quickly at the start of a team-based event. And this is called a mental model. And teams perform better when they're able to share these mental models between one another, between professions, during a high acuity event. And what we know about stress is it shatters shared mental models. It shatters the sense of we-ness, which is also spoken about in flow. and takes people back to a very me-centered approach, which is adaptive. That's what stress does. It makes you kind of revert back to that notion of fight or flight or survival. And it's very destructive to this notion of team cohesion. And it's a bit more complicated than that. The acute stress response as it relates to performance isn't just an on or off thing. It tends to have a lot to do with how you appraise the situation, and something called the two-step cognitive appraisal. So when an individual is faced with a challenging situation, they tend to do this quick cognitive estimate of the demands of the situation and the resources that you have to bring to bear. And if you appraise that demands are in excess of the resources that you have to resolve the issue, then you appraise that as a threat, and we can measure this. We can identify the threat appraisal experimentally. And as it turns out, the threat appraisal is what's so destructive to performance, because when people feel threatened and they feel task overloaded and they feel overwhelmed, that's when their performance bottoms out and falls apart. Now, the challenge appraisal is a bit different. You're still feeling stressed out in that circumstance. Your heart rate is up, your blood pressure is up. You probably have less of a cortisol bump than you do in the threat appraisal, which is important. But when individuals and teams feel challenged, they overperform. Their performance goes up. And again, you can reflect on your own practice and think about that. If everyone in here walked into a resuscitation in the mindset that they're currently in, how well would you perform? I think it gets to the data we heard about rest and performance, and whether or not a well-rested, relaxed team member is really the best performer. I don't know. Maybe it partially explains that. The holy grail of stress preparation is this notion of converting threat to challenge appraisals, not to eliminate stress, but that perception is highly subjective. And if you play with the perceptions of threat and challenge and demands and resources, you can push people towards better performance, not worse performance. And if you were listening to your other part in the talk, to me, that sounds a lot like pushing towards flow. Pushing through that struggle, pushing towards that release, and then pushing towards that next plane of performance. So I think the challenge appraisal is a really interesting thing to look at to see how teams and individuals get better based on their cognitive appraisal of a situation or a circumstance. And there's a lot of different ways to do this. We experimentally are looking at something called stress inoculation training. It's not the only way to prepare for stress, but this is a fairly simple, fairly straightforward three-step process where you teach people about what stress does to teams and to individual responses and performance. You then educate them on very specific techniques that they can apply in stressful situations. Then you take them through increasingly stressful situations. That's the inoculation process. And you instruct them on how to apply those skills in a graded fashion. So that's stress inoculation training. The interesting thing about stress inoculation training is it seems to be quite easy to achieve in a fairly short period of time. So most of the experiments on this early on suggest that 3 or 4 sessions of a few hours each is probably enough. Important for everyone in this audience, if you do emergency medicine or critical care or anything that really involves variety of practice, the skills seem to be quite generalizable. So if you learn them in one context, it seems to be possible to apply them effectively to an entirely different clinical context. And that's important for us because we're always seeing different stuff. And it's extremely durable. If you look at the neurochemistry of people who've undergone stress preparation training, then levels of things like DHEA and neuropeptide Y, which are thought to, in part, attenuate the effects of cortisol on the brain during a stress response, are much higher as compared to people who haven't undergone it. And something called heart rate variability is changed as well in a very lasting and durable fashion in people that have undergone training as a proxy for one's physiologic stress response. I was going to take you guys through a shared breathing exercise, but how many conferences can you go to where the audience has already done that a few times already before the last speaker gets up? In both flow theory and science and in stress preparation, one of the first and most important things that comes up is the importance of controlled breathing. It's the steering wheel of your autonomic nervous system. It's one of those few things that you can control consciously. And in both stress science and in flow science, if you're feeling that struggle, if you're feeling that strain, if you're feeling ramped up or amped up, not in a good way, one of the first things you should do is consider taking some controlled breaths to get a handle on that adrenergic response. Norepinephrine goes down, adrenaline goes down, cortisol goes down. Doesn't have to be triangle breathing. It could be square breathing. It could be yoga breathing. I don't care what it is. But it's one of the most important and early things that you can do to address that acute stress response. The second one is one that I've always kind of struggled with, but I'm starting to appreciate more and more as being important, and this is the notion of cognitive reframing. And this is the simple cognitive act of taking a process or a thought or an idea or a situation and reframing it and reshaping it in a way that it becomes much more manageable and easy to handle. So this is the basketball team that's down 12 points in the fourth quarter, and they're panicking. They're passing the ball out of bounds. They can't make a shot. They're running wild. They forgot all of their strategy. And it takes a veteran on the team to call a timeout and call our team over to the sidelines and say, look, what we need now is a stop on the defensive end. Let's talk about how we're going to do that. And then we can worry about the rest of everything else that has to happen next. So breaking complex tasks down into simpler, more manageable parts, and then reframing your appraisal of that situation to make it seem like it's something you can handle. And a lot of this is directed towards the concept of moving your locus of control from external to internal, so you have a more internal locus of control. You feel some empowerment over the situation, and then you're able to execute some sort of influence on the outcome. So a couple of strategies for that I like. One is task chunking, which we just talked about. You kind of take a big thing and you break it down into smaller parts. And for anyone who was at Karim Brohi's talk yesterday, he very eloquently described this in the trauma patient when he was talking about the Zen of trauma surgery. And he said one of the most important things you could do as a team leader is just figure out what's essential for the care of that particular patient, and then what's nice or what's nice to have versus what you must have. And you focus on what's essential and you get away from all the other stuff, and you can actually perform in that circumstance, whereas if you try and do it all at once, you can't do it. And then perfection bashing, which is understanding that, say, in a 26-person mass casualty event, you can't do everything for everyone, so you might as well stop trying. And you reframe the issue as saying what's acceptable, what's necessary, what's important, versus what would be perfection. Because if you shoot for perfection, you're never going to get there. And then there's the concept of mental rehearsal, and this is something we've been looking at a bit experimentally with teams as well. And this is based on something called dual coding theory. That is, that your long-term memory can remember things and encode things better if it receives input from multiple sources, multiple cognitive sources. So thinking versus saying versus doing, and so on. And in healthcare, it's been shown, as in sports and athletics, that mental preparation and mental warm-up is very useful for technical skills. And we've seen that it's probably a little bit helpful in terms of team-based skills. Teams perform a little bit better when they warm up mentally together before they go into a complex resuscitation. And we're trying to look at this from a flow perspective to say, well, maybe it's a good way to get people a bit more co-oriented early on in the resuscitation so that they can get that sense of a shared mental model earlier. They can start doing what we call group flow, which again, it sounds like a spin class, but it's a real thing, where people actually start flowing together earlier on because they share a sense of shared mental model and process. So we've been scripting this out, and this isn't law, this isn't necessarily science, we're kind of testing it to see if it makes sense. But as far as I can tell, sort of a team-based preparation script should involve probably at a minimum these four things. So you have a patient coming in 30 seconds, you know this much about them, and you can sit down with your entire team and say, okay, what information do we have? What do we know? What do we expect to see based on that prediction? What are we going to do? And keeping that prediction limited to the first 5 or 10 minutes so it doesn't seem like it's going to get out of hand or out of control or unmanageable. And importantly, how are we going to respond if our initial interventions fail? Understanding contingencies and understanding that treatments do fail and that we can cope with that and we can manage that by having a plan for failure. And then who's going to do what? So what do we know? What do we expect? What are we going to do? And who's going to do what? So stay tuned, but that seems to be a decent way to sort of frame this pre-huddle or pre-team discussion in the 30 seconds that you have before a patient arrives. And the last one, man, if you don't like a picture of a golden retriever smiling at you with a flower on her face in the snow, I don't think we should know each other. It's one of the happiest pictures I've ever seen. So stress and anxiety are just a couple of the emotions that can affect our decision making. And actually, we're less clear on whether it's an issue of emotion or emotional valence, which means all the positive emotions, happiness, joy, excitement, and all the negative emotions, fear, anger, stress. We tend to believe, or at least we have in the past, that our cognition is somehow a separate process from our emotions, that our new brain, our neocortex, is somehow more rational and can escape from the irrational nature of feelings, whereas the strength of connections in our brain would actually suggest the opposite, that our emotional centers in our midbrain exert much more of an influence over our neocortex and our decision-making than the other way around. And this process is still at its infancy. We're starting to look at the ability to do what's called mood manipulation. Can you mess with people's moods? What does that do to their decision making? And then can you train that process to make it more adaptive? Everyone know who this is? This is Cliff Reed. This is Cliff getting filled out like an application in a Brazilian Jiu-Jitsu competition. And he wrote a blog post about it. And if you haven't read it, I would encourage you to do so. It's wonderful. What he talks about there is entering this competition as an amateur and getting beaten badly. But what the process of training and preparation and fear taught him about skill mastery and deliberate practice and facing one's fear. And this comes up in flow science a lot. The idea of using fear as your compass to point yourself at something that makes you afraid and then train very deliberately to get past it, understanding that our true potential, that our true performance lies on the other side of our fears and our anxiety. Not in a macho way, in a very humble and self-aware way, to recognize that you have these limitations, you have these fears, but that you can also help to train your way through it. And in flow science, they talk a lot about the skills challenge ladder, that we should be constantly setting our challenges a few percentage points above where our skills lie. And then we continue to drive at that gap with repetitive practice and training, which really is deliberate practice on steroids. And this is what snowboarders and surfers do so well. They just keep pushing themselves and pushing themselves and pushing themselves just a little bit beyond where their skill set lies. And they accelerate their mastery to tremendous degrees, not only in terms of speed, but in terms of the type and degree of mastery that they can achieve. But we're not surfers. We deal with patience. And we can't go out there and just catch a million waves until we figure it out, because that would probably harm people. Or can we? So this was the In Situ simulation exercise we did as part of the In Situ workshop on Monday. That's a mannequin lying at the bottom of the stairs as part of a live In Situ simulation demonstration. In a lot of ways, this talk is really a call to action to anyone out there who takes part in simulation-based education, and particularly people who are involved in designing simulation exercises. Because I really believe that this is the key. If you talk about designing simulation for teams that vary complexity, that vary the challenge level, that consistently push teams to go just a little bit beyond their comfort zone, to go a little bit above their skill level, and then just keep accelerating that process and repeating it over and over and over again, that's exactly what simulation is good at. And my belief is well-crafted, well-designed, thoughtful simulation exercises for teams, building in these concepts of stress preparation, mental practice, cognitive reframing, emotional valence, and emotional manipulation are probably some of the key concepts that we can build in to make that sort of training even better and even more important. It's right under our noses. I just don't think we've figured it out just yet. This is Steve Kotler's quotation on what it's like to be in a flow state. Time flies, self vanishes, performance skyrockets. Sounds like a pretty nice way to live. They talk about being in flow states as being autotelic, meaning they're self-rewarding. You do it for the thing itself. You do it for the joy of training. You do it for the joy of preparing and for the joy of performance. And that's kind of what we're talking about here is joy, is feeling the joy in the work we do and the joy in the sort of training that we do. And wouldn't it be nice to be able to train in a way that recapitulates that joy and makes us better at the same time? And I don't know if any of you have done simulation exercises where you've seen teams come out of the sim room and they look like that. They're activated, they're talking to one another, their eyes are big, they're blown away by what just happened, and they can't wait to go to the debrief room to talk about it. Well, for you sim educators out there, that's where we need to be. That's what's going to push the limits of performance. That's what's going to push flow states. And I think in the end, that's probably what's going to make our teams better than we ever could have imagined them being. So stay tuned for how. I'm still trying to figure it out. That's me. Thank you very much.
That was awesome. The concept of being in a flow state, I mean, that just sounds like it's the right place to be. So yeah, I'm into it. All right, Celine, what do you got?
Yeah, I got two questions for you. The first is, somebody in the audience noticed that you used the phrase stress preparation versus stress inoculation. Was that intentionally different, or are those like different things?
I may have misused the phrases, but they are different things. So stress preparation is a kind of a generic phrase for preparing for stressful events. there are a variety of strategies for stress preparation, of which stress inoculation is one. There are lots of others like overlearning, mental rehearsal that build into that. But I would say stress preparation is the umbrella term. Stress inoculation is kind of a specific technique for how to get that done, and probably one of the better researched ones out there in terms of how well we think it works.
And the second question, sorry, does stress inoculation training suffer from macho militarism as meditation suffers from guruism wankery?
Yep. I don't know. We can add wanker to pretty much anything. We can have a stress inoculation wanker hashtag out there. I mean, I alluded to it at the end, right? I think this area of investigation and practice suffers a lot from the sort of machoism we tend to heap on it. And I think that's part of why I like Cliff's post so much, because he approached this concept with a real sense of honesty and humility and a recognition of one's limitations. And I think that's how it needs to be approached. Because the machoism just kind of implies what we've kind of been doing all along, which is we kind of got to give her and we got to white knuckle it and we can muscle through it because we're tough enough. And frankly, I think that approach has failed us, and that's why we're looking for other ways to do it. So I think we're all, myself included, we're probably guilty of making this seem and sound more macho than it actually needs to be, whereas I really don't think that's the approach we want to take.